Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department, joins us again this week. Hello.
Hello, ma'am.
Well, going into the holiday weekend, we were hoping to have some good news to share, but it looks like our numbers are actually on their way back up. Tell us what's happening.
That's right. Our positivity rate is up to 9%. We are seeing daily numbers approaching those that we had with the Delta wave just a few weeks ago. Very concerning heading into the holiday weekend. We know a lot of people are looking forward to traveling and things like that. And, it should be of particular concern to those that are unvaccinated. We've talked about time and again that those that are vaccinated are less likely to develop symptoms, virtually impossible to be hospitalized, virtually impossible to die from COVID if you've been vaccinated. And yet we still struggle with that.
We were doing so well. We were on our way down. What do we think is causing the numbers to spike again?
Well, we were thinking that it was partly to do with the holiday or with Halloween. We're almost a month removed from Halloween at this point, so we would hope that the number would be trending downward. We're still seeing a high level of cases in schools, predominantly in that 11 and under age group. So, of course, that's the middle and elementary school kids that are just now eligible for vaccination. The other thing I think we could start looking at is associating it with indoor sports and more indoor activities as the weather takes a downturn.
All right, so the holiday weekend is ahead of us. I'm sure some of us are already thawing our turkeys. So what do you suggest that we do if we've got a house full of people coming over this weekend?
Wash your hands a lot and, make sure you're cleaning your surfaces. Ideally, we're getting together as a vaccinated family. We got to do what we can to safeguard those. Not everyone that's, the other thing to remember is not everyone that's not vaccinated is anti-vaccination. There are medical reasons to not get vaccinated and things like that. And, we need to do our part to help safeguard those people. So it's back to what we've talked about. If we're unvaccinated, we need to very seriously consider, do we need to stay home? If we are sick, we definitely need to be staying home and limiting our contact. But, the other big thing would be, let's not do buffet style service either. Let's have one or two people serve everyone individually. That would help reduce your contact on the utensils and everything like that, and help reduce the spread of germs.
So I'm walking through Walgreens the other day, big end cap of these home tests. And I know they're not perfect, but is there any logic in having everybody maybe take a home test before they come over on Thanksgiving Day?
Well, it wouldn't hurt. The thing's going to be that, the ideal time for testing is between 3 and 7 days after exposure. And, we don't know where we're necessarily at if we don't know if and when we've been exposed. So, I mean, it's not a bad thing. It's not even an invasive test. It's the cost benefit analysis of it. Is it worth paying that money to have it done or to do it yourself and get those results? And does it really change anything? So, I mean, it's the family's going to have to figure out what's right for them. And that would certainly be an option for potentially finding an asymptomatic individual.
Sure.
So, I mean, I wouldn't necessarily rule it out either.
So what's the latest on boosters? More people are eligible starting today. Tell us who and how we go about getting them.
Yep, that's right. Everyone 18 and over is eligible for a booster vaccine. They do need to be 6 months removed from their second dose. So, we need to pull out those cards and take a look and see when we got our vaccine. But for 18 and over, they are still welcome to walk in or make an appointment for our site at the fairgrounds. And there's 74 other vaccine sites just within our county where folks can go in and get their boosters if they're eligible for them. Obviously, we'd highly encourage them to do that as we move into the holiday season.
Now, I know that we can just do walk-ins for boosters, but that's not the situation with kids and the Pfizer vaccine. So bring us up to speed. How are we doing in terms of vaccinating the kiddos? And what are we looking at in terms of finding an appointment for them?
Yeah, so countywide, we've vaccinated about 6,800 kids, 5 to 11 already. We still see an incredibly high demand that's outstripping the supply. So at our site in particular, I can't speak for anyone else, but we are requiring appointments for the 5 to 11 age group. We're hoping that the supply chain catches up. We're able to start just administering more vaccine. As soon as we can, we'll start making more appointments available and start cranking them out. We probably will move back into a walk-in model as well.
Fantastic. Do you want to add anything else before I'll let you go?
Last holiday season, we saw a extremely large increase in cases. Unfortunately, it looks like we're already starting to trend that way. So, I think we need to, number one, if we're not vaccinated, seriously consider getting vaccinated. If we're not boosted, let's go do that. Let's get the kiddos in there and get going. Hopefully, we won't see the repercussions on the healthcare system that we saw last holiday season as well.
Fantastic. And one other final question. What about vaccinations for the holiday weekend?
So we will be closed Thursday and Friday of this week. That's the 25th and 26th. And then as we look into December, we will be closed. I believe it's Christmas Eve and Christmas Day, or the 24th for sure. We may be closed the 27th. I'll have to look back and we'll have to report on that again as we get closer, but the 24th for sure in December.
All right. Thank you, sir. Have a happy Thanksgiving.
You too.